when people struggle with substance use, they oftentimes, not always, but the research definitely confirms this, not always, but oftentimes there's often something else going on, right? And out of all of the other mental health challenges that can arise when somebody really struggles with substance use disorder, trauma, PTSD, complex trauma, symptoms of trauma oftentimes are correlated to it, right? Meaning when somebody is struggling deeply with addiction, there's a lot of times when there's a trauma history there. It doesn't mean everybody who's struggled with addiction has a trauma history. And it doesn't mean everybody who struggled with addiction or substance use disorder or substance dependence has other mental health issues going on. But most of the time that is happening, right? Substance use disorder doesn't happen in a vacuum. And it's really important to contextualize this, right? Because even the idea of what mindfulness is, what we were talking about in the last lesson of equanimity, right? Equanimity is being present to whatever is arising as it arises and not putting more attention into one area than the other, right? So if there's trauma and there's mental health issues, if there's trauma and substance use disorder, we want to look at the whole picture holistically, right? It doesn't happen in a vacuum. And since the experiences don't happen in a vacuum, the treatment doesn't happen in a vacuum either.